Okay, hello everyone. I am actually coming to you with another short webinar, free webinar, and I've got my notes. So let's see here. Okay, we are going to be talking about how I'm actually using LinkedIn to attract sponsors, clients, and to help build up my clinical research site, and what it actually means and what it actually takes to launch a research site in a rural area such as Southeast Missouri, Sikeston, Missouri, in a research naive area. If you do not know me by now, my name is Alicia Moore. I am the CEO of Clinical Science Research Solutions, and I'm also the founder of a nonprofit organization called I Am Research and Wellness Foundation. So in this 20-minute webinar, I'm going to show you how, again, I'm using LinkedIn to build a clinical research site from scratch in Southeast Missouri, and how I am working on attracting the sponsors, the right vendors, and the clients. And I'm working with grant writers to help fund my initiatives and my mission along the way. A couple of things that you're going to learn is basically what the $2.6 billion DEI push is missing, why the infrastructure gaps matter more than ever, and how I'm working on building the site and the workforce, the AI strategy. I have the nonprofit organization, the marketing pipeline to help, ensure that I'm aligned with the sponsors' priorities. Okay, again, welcome to this webinar. I am super excited to have everyone here. We're going to learn a little bit about what I'm working on. If you are not following me on LinkedIn, please follow me on LinkedIn. If you're not subscribed to my newsletter, please subscribe to my newsletter as well. And then if you're not subscribed to my YouTube channel, I urge you to subscribe to my YouTube channel, and please watch and comment and share. All right. Again, I want to emphasize that, I'm the CEO, I'm the founder. I'm working on opening up my own clinical research site, not only in Sikeston, but in Cape, Dorado, and Poplar Bluff. I also have some mentorship packages or courses, if you will, for anyone that's looking to start, not anyone, but if you're looking to start a research site in a research naive area, we will be building that program from the ground up. Right now, it's in its early stages because I'm in my early stages. But with this particular mentorship program, with all my mentorship programs, I bring in guest speakers depending upon which topic we are talking about. So I make for sure that my clients have exactly what they need. I will emphasize again, if you haven't heard me say before, nothing that I do is cookie cutter, even down to my mentorship programs. They're very specific. They are very niched down, and I have all the resources in one spot. That way you do not have to go looking for anything at all. And then also we'll talk about how, I'm working on building these research sites starting in Sikeston, Missouri, because this region, a lot of times this region is overlooked by big companies and sponsors, and they really don't know we're on the map until we actually start advocating for ourselves and for our communities the way I am, and just posting and teaching on social media, or having, those private conversations with, let's say, somebody that's at the YMCA. We now have Starbucks here in Sikeston. So even sitting down and having coffee with a friend, or sitting down and just, sometimes I like to bring my laptop in and work. And I will purposely strike up conversations and ask simple questions. I know a few weeks ago, about a month or two ago, whenever I was at the Starbucks in Cape, I love working there. Everybody knows I love my coffee. I decided to go ahead and just, approach the manager. I found out who the manager was at that time. And I asked if, Starbucks, they actually support nonprofit organizations. And I'll get into that a little bit as it pertains to hosting certain events that will help educate the community, and they will. So I'm working on quite a few things behind the scenes to ensure that my community, they know exactly who I am and what I'm doing and what I'm working on building and bringing to Southeast Missouri. These are some crazy statistics that I'm going to share with you. And I have my notes. You can take some notes as well. While 86% of rural counties have zero now, trial access, only 14% do. I live in Southeast Missouri, and we face higher rates of diabetes, stroke, cancer, mental health crisis than much of the United States, but we've had no infrastructure, and I'm building that. Oh, and another thing, another reason why I wanted to bring forth what Southeast Missouri is facing as far as health-wise is because those particular studies that I'm looking to bring into this area will help in these particular therapeutic areas: diabetes, stroke, cancer, oncology, psychology, cardiology, etc. So I'm bringing this to the forefront so sponsors will be able to see like the studies that will be beneficial to this area. The minimum anyway. Okay, why sponsors still they can't find what they claim they want? Well, the question I want to ask the sponsors are, where are you looking? Are you doing any kind of market analysis? Are you asking, the people the right questions? Most of the time they are not, or sometimes you just don't know that rural towns like mine even exist. Whenever I talk about Sikeston, Missouri, to others that are in the bigger cities, whether it's Texas or Michigan, the question they will ask me is, well, what is Sikeston? Where is that? And I have to basically tell them, like, hey, if you are familiar with St. Louis, we are 2.5 hours south of St. Louis. Sometimes that may or may not ring a bell. I have every once in a while I have to throw in, okay, have you heard of Lambert's, home of the throne rolls? Every once in a while they'll say, oh, okay, yes, I know that place. Okay, that's where we're located. Very, very small rural town. Now the sponsors, if you notice, look at how much they're spending on DEI, over $2.6 billion annually on DEI initiatives in the clinical trial space. They're spending all that money, but our counties, the rural areas, we're still being overlooked for whatever reason. And a lot of times it's because most of the time they may or may not know. This is not necessarily about metrics. It's about the location, the access, the trust, that we should be working on building in this type of community because of the mistrust, the skepticism, just the unknown plagues this area quite deeply. And even whenever I mention clinical research, the question people ask me is, well, what is clinical research? So I decided that before I even plop a clinical research site in Sikeston, Missouri, the first thing I need to do is make it known who I am. Most people, for the most part, they know exactly who I am, but they don't know what I do. And even whenever I explain to them what I do, I know my family have told me on many occasions, Alicia, it's still like very complicated. It's easy for you to explain, but for us, we still do not understand what the heck is going on or what is clinical research. So that's whenever I decided to, and I realized that We need education here. And I know some people may kick against that and say, oh, you don't need to create these courses. Yes, we do. Yes, we do in these rural areas where clinical research doesn't exist. We have to find ways of implementing the trust. So you implement the trust by educating the community. And I'm building out this wonderful, stable ecosystem that's going to touch on and help educate, let's say, research naive doctors, individuals that are coming to my soon to be clinical research site, like study coordinators. I have that, not the mentorship, the course. We're working on building that. And then the CRA. So having all those courses, let's say if they're not wanting to become a CRA or CRC and they just want to learn more about the role, well, we have those courses, right? Okay, the Missouri data that changed everything. So 100% of the counties in this region are designated as mental health. A lot of people have mental health issues. 45% plus of the residents live in medically underserved areas. And you want to know what that means? That means maybe not necessarily for Sykeston, but smaller towns, maybe like in Malden or New Madrid, Lilburn, Portageville. A lot of those individuals have to travel, 30, 45 minutes away to even get to a clinic or even the hospital. Now, we do not have a clinical research site. So that means by implementing or placing this infrastructure here in this area, that's going to eliminate, for the most part, rural individuals, residents that live in the area from traveling so far to participate in a clinical trial. It's so, so important for sponsors to connect with individuals like myself. And we have these meetings, we have this health and wellness initiative. We are working at this, as a matter of fact, my nonprofit organization, we are having our first kickoff event, a webinar conference in October to help. We're bringing in guest speakers from the industry so we can explain to this community the different sectors that are compiled or composed, the different sectors that consist of, that make up the clinical research industry. Not all, not everything, but they're going to have a higher level overview of what goes on behind the scenes in the clinical research space. I'm really excited about that. I can't help but I'm really, really excited to be doing, bringing all building this infrastructure in this area. So let's see here. The top quartile in the state, it's plagued with chronic diseases. According to the CMO, AHEC, and Missouri DHSS, Southeast Missouri ranks in the top quartile for chronic disease burden. Again, I cannot emphasize enough. It would be very, very important to bring clinical trials into this space so we can find, hopefully find more solutions to reduce chronic disease burdens in this area. But it has to start with someone like myself. I'm living it, I'm breathing it. I know exactly what it's going to take to even get the ground running, to get these things up and running, because it's a slower process. Only because, our physicians are not even in research, clinical research. Our colleges, they do not have clinical research education. And it's important that I bring this academy to this space, because again, we have nothing, literally nothing. I'm the only one in this area doing anything remotely clinical research, which is great. And I'm loving it here. I'm in love with what I do. So I'm ready to work, and I'm hoping that I'm able to partner, with the sponsors and other site owners. And, I'm working on partnering with the right individuals in this space so we can make it happen. So we can help get this information out there, help reduce the amount of mistrust that we have in these particular communities. Now, this isn't just a site, it's a blueprint. Again, for me, I did not want to just say, okay, I'm opening up a clinical research site. Let me go find a doctor. Let me go find a building. And then boom, here's a clinical research site. Hello, everybody. Come participate. That will not fly here. So what I decided to do, and again, is build a really solid ecosystem. And I mentioned my academy, my Principal Investigators Academy, CRA and CRC. And my goal is to have a pipeline of trained professionals. So say, for instance, even not just for my site, if there are other rural sites that need trained individuals, I will be providing that training for research naive sites, or even for sites that, they do not have the bandwidth to train their candidates. I will be responsible for training them. I have instructors that have been hired in to help me facilitate this process. Again, this is helping building trust within the community. That's why I have my nonprofit organization, so we can do the health and wellness fairs. I can have the lunch and learns, let's say like at the YMCA, or I can, create cute, small little events. Let's say now that we have Starbucks, to do like a meet and greet with me, or have just, small coffee chats. And it doesn't have to even be a big group, because what will happen is whenever you have those small events at the coffee shop, the word will eventually spread. It's going to spread abroad by word of mouth. And that's how I'm going to be able to get my name out there, what I do, the brand, what I'm passionate about, how this is going to benefit the community, how this is actually going to bring in jobs that do not exist in this area. It's going to bring in volunteering experiences that individuals will be able to put on their resumes. So it's something totally different in this area that I'm truly passionate about. Of course, we'll have DEI integrated programs implemented from day one, because again, we live in a research naive area. We live in a population to where, you have an underserved community that's going to be so beneficial to participate in these clinical trials, because we don't have enough of, let's say, African Americans participate in the clinical trials. And we, live in these underserved communities, and we're not the only ones that live in these underserved communities that need to participate, because a lot of drugs that go to market may not necessarily help African Americans. And one of the drugs I can think about right now is lisinopril. Lisinopril is not necessarily great for African Americans. I myself, I take blood pressure medicine, and I completely avoid lisinopril. In my mentorship programs, I have a mentorship programs for individuals that are looking to start their own site. And what you will have are the legal SOPs that are written by my clinical research lawyers. They're written, they're legal, they're ready to go. You will have to purchase them, but those resources will be there because I have connections with the right people that can supply my clients exactly what they need whenever they're ready to get started on opening up a research site. They will not have to go looking for it. So that's another benefit, another ecosystem a blueprint that I'm putting in place. Again, I touched on outreach initiatives, hosting the events, health and wellness events that's going to bring in the community, and then forming partnerships with the hospital. So anytime they have any kind of events, I will be able to participate as well, have my flyers out, maybe t-shirts, things like that. And then we're also going to be AI ready. What am I building the ecosystem map? So my first clinical research site, the goal is to open it up here in Saxon, Missouri, which I will. Then we have other towns that are nearby. Poplar Bluff is about a 45-minute drive away. Cape Girardeau is about a 30-minute drive away. And there are other nearby counties that New Madrid, Lilburn, they're about 20, 25 minutes, 30 minutes away that I would love to, implement, have sister sites in those areas. Now, and I just went over this, some of the key pillars. Another thing I want to talk about, I have that here. The key pillars, again, is opening up a clinical research site. I'm working on the education to help develop the talent in the correct way that they're educated. I am a huge advocate for education. I do not believe in throwing people in positions that they know nothing about, or that they've just taken a GCP course only and nothing specific for the role. I want to teach courses that are specific for PIs, for CRCs, for CRAs. And of course, we're going to do, AI integration, because AI, I feel like, is taking over the world now. So we have to stay up to par. AI will play a huge part in patient recruitment and whoever I network with in that area, the database, and those particular things that will help even match us to sites, or match us to, CROs, or match us to the right studies. I touched on the IM Research and Wellness Foundation, what we're all about. Again, we will be having our conference, first conference, kickoff conference, October. It will be online. Please reach out to me if you are wanting to sponsor the event. We will be very excited to have you sponsor. I'm also working with my own personal digital marketing team, Digital Auxilius. They are doing a magnificent job. I'm really excited about working with them, because they will help with the SEO optimization. And if you do not know what that means, most people will know. It actually helps attract the right client's avatar to me based upon the services that I have. And then also the marketing team, they will help do the content writing, the ads. They will help with, once I start getting, studies for my site, they'll create, let's see here, recruitment flyers for patients to see, or for individuals to see. And they're also going to create the materials that I need to even, let people know about the courses, let people know about the mentorship program for aspiring site owners, and then also the corporate program, mentorship program that I have for CROs, sponsors, and like the hospitals. And it's important. I totally agree with having a marketing team way before you even launch a site, because you need to set some kind of blueprint, a foothold within this industry. That even goes for putting yourself on the map, so sponsors are aware of who you are, and you're not just, plopping your business somewhere, and then it's almost like backtracking to try to get yourself out there. So it's best to start marketing and branding yourself right now, and that's exactly what I'm doing. If you are a site owner or an aspiring site owner, you need to start marketing yourself right now. The way I originally started marketing myself was, I thought I wanted to get into the CTM role or project manager role. So what I did was I tried to, talk about those things that surrounded the role of a CTM. Well, that didn't work. At least I thought it didn't. But what did work was I gained a lot of speaking opportunities. 4 times. One, I was not able to make it to one of the conferences, but even so, that started to put me on the map. And I don't have a site yet. I started talking about, the mentorship programs that I have, and I even launched one, and I've talked about this before, in April, 2 of them. And because I've been marketing and branding myself, I finally was able to niche down the avatar, if you will, on who I'm supposed to be catering to. And a lot of times it's yourself, and a lot of times it's us. So my market, my avatar, who I am talking to, research naive areas, research naive physicians, research naive, nurses, PAs, lab techs, phlebotomists, just once again, getting the education out there, and having a marketing team that knows exactly what they're doing. Now, Digilist Marketers, or Digilist Auxilius, sorry, they have an incredible track record. Track record. So sorry, it's late. I apologize. They have the receipts showing and demonstrating that they know how to put you on the map and then bring in the clientele that you need. I was blown away by what they have to offer. And I said, okay, it's go time. Let's go ahead and get them hired. So I urge everyone, literally everyone, to hire a marketing team as you're scaling your business. That's part of my ecosystem. Grant partnerships. Make sure and I did not know that there were clinical research grant writers that existed. One of my board members from my nonprofit organization, Dr. Crane, as a matter of fact, happened to be on LinkedIn. Once again, LinkedIn is where it's at, searching for grant writers, and she came across clinical research grant writers. So I have made 2 appointments with grant writers, and I was blown away with the opportunities that my organization, profit and nonprofit, will benefit from. So those particular topics, marketing, actually my marketing team will be a part of the mentorship programs. I will be bringing them in so they can talk to my clients. And I will also be bringing in my grant writers to talk to my clients as well, because you need to have a way to offset some of the costs. That way you're safe on both ends. Even whenever you do the budgets and contracts with the sponsors, you still need to have another avenue of income coming in that's going to help take care of the other expenses. Okay. Where are we? We are at the AI plus tech strategy. We're not waiting. We are actively seeking partnerships. I will be reaching out to Deep 6 AI patient matching, CliniThink, which has, looks like EMR parsing. We're still in the early process of working on partnering with Creo. I'm excited about that. And actually with Creo, we are working on integrating Creo's platform into my PI course, CRC and CRA course, because there are sites that use Creo. And for me personally, I said it's no sense in training students and they go to the sites and they really do not know how to use a vendor or what it comprises of. So I and Creo, they are creating an educational sandbox so that my clients will have access to, and we can, do those demonstrations and actually practice on real life scenarios. So by the time my students are done with the courses, for the most part, a lot of the training, the site managers or the employees, they're not going to have to worry with, because I'm going to do the bulk of it. I'm happy to do it. The goal is to make sure my area is tech ready for recruitment, retention, and regulatory efficiency. And of course, well educated. Again, I will touch on the role of IM, Research and Wellness Foundation. And by the way, I stands for Isaiah, which is my son. A stands for Alicia, obviously me, and M stands for more. The focus of our initiatives in the areas is hosting community town halls, lunch and learns, webinars like this one, health and wellness events and mental health awareness. We will be building programs for individuals that have, at one time they were well, but now they are sick. So I have someone by the name of Dr. Khan. She will be teaching, and we will be implementing, some courses, materials, and helping individuals transitioning from having what used to be a normal life to adjusting to having a new normal, living a new normal. And that can even be with their family members as well. Again, my online conference will be October of this year, October 23rd, 2025. Please reach out to me for more information. The goal is to educate the public community about clinical trials. What is clinical research in the first place? And actually just building out those particular modules for the community, which will reduce the stigma, and it will improve the access. And it will improve the access because now they know more about what we do. And they also know that we're not trying to harm them and we're not using them as guinea pigs. We have to somehow, we're probably not going to completely get rid of it, but, reduce that thinking, that mindset. And that's by building the trust and showing that you actually care, showing that you are wanting to serve the community. And that takes teamwork from everybody, from the sponsors, the CROs, site owners, the employees, myself. It takes all of us to do it right. Also very exciting, I have my own personal conference I will be hosting in 2026. More details to come. I'm looking for sponsors to sponsor the event. I'm looking for some guest speakers. Reach out to me. I am happy to have a conversation with you and to partner with you on my first conference. I'm super duper excited about it. I pretty much have the agenda written out. My team and I were going to go over the vendors and where we're going to have it. I have an idea of where we're going to have it. Just the whole event. We're thinking about one day, but it might spread into two. Haven't decided on that yet, but just be on the lookout for my conference that's coming up next year. And then also, again, I have partnered with grant writers. We're going to focus on ensuring that we can receive the grants to, help pay for a lot of the, let's say, the conferences or meals or, maybe again, the health and wellness events, those things, obviously, as you know, they cost money. So we have to have some kind of way of paying for what we're doing. The tech, that even goes for the videography, photography. So buildings, rents, as business owners, you know exactly what I'm talking about. So just having access to grant writers is simply amazing. Again, they have a paid database that they can actually go on and see the grants that are coming in daily that businesses like myself in the clinical research space will actually benefit from. And again, this is something that I will be providing in the site ownership mentorship program. Again, you will not have to look for a grant writer. I already have 2 grant writers that will be of great resources to you. What do CROs and sponsors need to know? Well, we're going to be audit ready, DEI integrated. We are going to have feasibility in mind and align. Expectations will be on point. Sponsors, you don't have to come in and retrain us. We're built for compliance and impact from day one. This isn't just a pitch. It is definitely a solution to a $1 billion problem. This is a pain point in the industry that I am addressing and happy to address. And if you're looking for diverse sites like the one I'm going to open and many others, we do need training. I will say that, but we're going to have the SOPs on deck. We are going to understand the enrollment pressure, and we're partners. So if you're looking to partner with myself, please reach out to me. Once again, we can form a great collaboration, great partnership with each other. If you are wanting to learn more, excuse me, join the movement. And again, if you're a sponsor, a CRO, please reach out to me so we can talk about collaborations. We can talk about the mentorship programs that I have for you, so we can help build out the right ecosystem in this area, in the rural areas, research naive areas. And I can tell you exactly what we need to do, and we can partner on that and talk about different strategies on what's going to be best for the rural areas. Again, I'm looking for research naive or rural area physicians and physicians that are looking to become PIs. Grant funders, I have, again, the grant funders on deck. They will be partnering. Actually, I'm working with them now. And again, that's a resource that you will not have to go looking for. And my call to action to you is just to join the full ecosystem. We are just getting started. Okay. Last but not least, follow me on LinkedIn, subscribe to my Researchpreneur Digest LinkedIn newsletter, and subscribe to my YouTube channel. It's going to help me out a lot. It's going to help get the information out there and put me on the map even more. So please like, comment, and subscribe. And comment below, what are some more topics you want to hear about as it pertains to the research industry, research naive industry? And if you're wanting to help, ask those questions, comment. Again, reach out to me. All right. And then I have one more thing. I am hosting a masterclass this Saturday. It's a paid masterclass, and you're going to receive all kinds of bonuses after the fact. If you are wanting to learn more about that, see the link in the bio. All the links to the mentorship programs that I have, the link is going to be in the bio as well. And again, the masterclass that I'm having this Saturday will be at 1 p.m. June 7th. It will be for an hour. The 1 hour masterclass, it's called From Research Naive to Revenue Ready. And what you're going to, some of the topics that we're going to talk about, I'll explore more into what the 86% rural site gap really means. We touched on that today, but we'll go further into more details. The cost of trial delays for sponsors and CROs, the 6 layers of the research site ecosystem in more depth, how I'm solving it in Southeast Missouri in more depth, and then how we can collaborate, or how you can collaborate with me, fund, and replicate this particular model. Again, the link will be in the description box once you are ready to take on this masterclass. And then after the masterclass, you will have free access to this particular course after you've paid for it. And then also, if you have enrolled in one of my mentorship programs, that is a little bit of money that I can take off for any one of the mentorship programs that you will, the site ownership program and the corporate program, not the others. I want to thank you again for showing up to this webinar. It's supposed to be 20 minutes long, but it ended up being almost 40 minutes. And please, please, please reach out to me. And if you have any questions, again, thank you so much. And I will be coming to you later on with another free webinar, free education, and more information about how we can collaborate and make it happen. Open up these research sites in these rural areas so they are no longer research naive. All right. Talk to you soon.